here?
Pain in my back. Constant. I had a friend that's living where we do, and she had the same procedure. And it worked for her, so I was down to last procedures. I had tried everything else, and I wasn't getting any better.
We're going to be doing a procedure that is quite novel. It's for lumbar spinal stenosis, which is a condition where the nerves going down the spine become narrowed and causes compression of the nerves. The patients who typically present with the symptoms with this condition are ones who have difficulty walking, they have difficulty standing in one position. Typically these are the patients that you'll find at the grocery store. They're kind of hunched over a shopping cart trying to get some relief of pain. And these are probably the patients or the subset of patients that would benefit most from this procedure, which is called XSTOP, which is a minimally invasive way of treating lumbar spinal stenosis. This model here is a representation of the lumbar spine. What you see are the yellow structures, which are the nerves that actually pass down the spine, the spinal canal, which is the opening in the middle of the bony spine, where at each level you have the nerves coming out, going to different parts of the body, of your leg. What typically happens in the aging process is that the discs actually start bulging, the joints start getting thickened, and there's a ligament over here that also gets thickened, and that together pinches off the nerves going down the spine, which causes a lot of discomfort and a lot of difficulties with patients' ambulation. What you typically do in this procedure, or what patients typically do, is when they're flexed, when they're hunched forward on shopping carts, they actually open up the canal and actually unpinch the nerves. So they're indirectly actually getting relief by unpinching the nerves, stooping and bending forwards. With this novel procedure, which is called XSTOP, you actually get the same results, except when the way the procedure is done is you bend the patients forward in the surgery room, or the operating room, and then you insert this device that fits right in between the two bones. With that, it actually locks that spine in an open position and prevents any compression of the nerves. So this way, when the patients actually stand up, when one stands up, that person can actually stand up straight without pinching off the nerves. So they don't have to be stooped forward or hunched forward to get the relief. This procedure typically takes about 20 minutes to do. Patients go home the same day. Recovery is a span of a few weeks. I have done over 100 of these procedures now and have had about a 90% success rate where patients have actually got relief and have avoided any big surgeries such as a lumbar laminectomy or a fusion. This is pretty unique. The PEEK material that we're going to be using is specifically for patients with osteoporosis. The previous material that I was using was titanium. It was all titanium design, which actually puts a lot of stress on the bones. So the people who have osteoporosis have a higher risk for fractures. With this new device that we have, which is going to be the first one in Michigan, it's made out of PEEK, which is a substance which looks like plastic but extremely strong, and it's not as hard on the bone as metal would be. And this lady actually has got osteoporosis, so she's got a soft bone. So I've actually been waiting to implant this in her for a while, and she's been getting worse over the past few weeks and past few months, and this device has just come out in a timely fashion, so it's going to work out beautifully for her. I tell you, working over here at this hospital is a totally different experience. I've worked at numerous other hospitals before, but the people and the staff that you have at this hospital in the operating room that help you with the cases, and they're just, I think, the greatest. And there's no other hospital that I've been to that compares to this one as far as the operating staff is concerned. They're very quick, they're very efficient. Like Jason here, he's my right hand. And Lisa Ojeda, who's right there in the corner, she gets patients in very quickly, gets things moving. And then you got Rebecca. She's actually the person who actually helps with the fluoroscopy, helps localize exactly where we are going to be. And then we have Jama, who's the CRNA. She actually makes the patients very, very comfortable, and pain-free while they're undergoing this procedure. So operating and doing these cases is a team effort. And the team that we have over here at this hospital is a AAA, not just an A team, it's a AAA team. What we're going to do first is localize exactly where we want to put the devices. And to minimize the incision size and subsequent discomfort, we localize with the X-ray. Go ahead, Rebecca. Here, come down. Okay. Kind of interesting, huh? That's why you
Sit low, eh?
Yeah. Can you give her 15 of Toradol at the end of the case, Sarah? What I'm doing is creating a space for me to put the XSTOP device, which is going to be right between the fins, so to speak, of the spine. That's where the device is going to get wedged. On, please. So what you have to do is create a little path for that device to be set. The device is not screwed in, it's into the bone, so it actually moves around, and it's free to move around. So that's the advantage of it. It's not a fusion operation, and it actually gets retained by the ligaments. On, please. So this is the actual device that Jason is putting together. It's a little spacer that's going to fit right in between the fins. And that's what creates the separation between the bones and indirectly keeps the nerves unpinched from each other. Okay, let's see what that looks like. Looks good. So that's one implant in. Let's see that, please. That looks good. Try to decide between 12 and 14. Let's do a 14, Brad. 14. I think 14 will be good. So both the devices are in at this point. We're just going to irrigate everything out and close the wound.